Hey guys, this is Dr. Hub. Today we'll look at the muscles which cause the movements of the hip. So first let's have a deep discussion on the diagrams. So here we have the superior. So this is nothing but the superior pelvic and the thigh muscles of the right leg. So this is the diagram. So let's look at what and all are present here. So in the superficial, pelvic and the thigh muscles. So before we go ahead with the movements at the hip joint, let's understand what are the muscles present here. So the muscles here, it includes the presence of the quadratus lumborum. Next, there is also the presence of the psoas major. There is the iliacus, the pectineus, the crest of the ilium, the tensa fascia lata, and the rectus femoris. There is a vastus lateralis. On the other hand, there is the psoas major, pectineus, sacrum, adductor longus. There is the gracilis, adductor magnus, sartorius, vastus medialis, quadriceps tendon or the patella tendon, and the patellar ligament. So this was nothing but the superficial pelvic and the thigh muscles. And to be precise, this was the right leg which you are seeing in the anterior view. Next, we have to look at the deep pelvic and the thigh muscles of the right leg, anterior view. So what does this include? There is presence of the pectineus, there is a pubis, there is a obturator externus, there is a adductor group, that is, it includes the adductor brevis, longus, magnus. And the bony marcations, there is the iliac crest and the femur, what we are seeing. Then we have to look at the pelvic thigh muscles of the right leg. So what do they include? So let's look at the bony locations. There is a crest of the ilium. There is presence of the sacrum. So other than that, let's look at the muscles now. There is the presence of the obturator internus. There is a gluteus maximus, that is cut. Then there is presence of the adductor group. The adductor group, that includes the brevis, longus and the magnus. Then comes the gracilis. There is the presence of the semimembranosus as well as the semitendinosus. Then on the other hand, let's look at the muscles. There is a gluteus medius. So we have already discussed about the insertion of the gluteus muscles in the other video. So there is a gluteus medius, this is cut, and there is a gluteus minimus. There is presence of piriformis, there is presence of the superior gemellus. There is also presence of the inferior gemellus. There is obturator externus. There is a quadratus femoris as well as there is biceps femoris. So this is nothing but the muscles. Now let's look at each movement. So in terms of flexion, so first is we look at flexion. So in terms of flexion, what is the muscles which are involved? The muscles involved in flexion, it includes the psoas major. There is the psoas major, and then comes the presence of the iliacus. So the psoas major, there is also the iliacus. The psoas major, there is iliacus as well as presence of the rectus femoris. So flexion, there is psoas major, there is iliacus as well as the rectus femoris. So let's try identifying in the images we did. So in flexion, the psoas major is involved, the rectus femoris is involved, as well as the iliacus is involved. So let's highlight them. So these are the muscles which are involved in terms of the flexion. Next, let's look at the extension. So in terms of extension, what is involved? In terms of extension, it is a gluteus maximus. So gluteus maximus is involved. This is all in extension. So there's gluteus maximus, there's biceps femoris, there is also the semitendinosus. So let's write in short forms, that is semitendinosus, ST, as well as semimembranosus, we are calling it as the hamstrings. So what are the muscles? We saw that is there is a, so this is in terms of extension, there is a gluteus maximus. So there is a gluteus maximus, then there was the biceps femoris. This is all in terms of extension. There is the semitendinosus, as well as the semimembranosus. So they are nothing but the hamstrings. So they are involved in the extension. Next, let's look at the abduction. So what is involved in terms of the abduction? So in terms of abduction, it is nothing but the gluteus medius. So it is the gluteus medius, the gluteus minimus, as well as the maximus. So in terms of maximus, it is the upper muscle fibers. So it is the upper. You are writing it as UMF, that is the upper muscle fibers. So it is assisted by the tensor fascia lata. So this is assisted with the presence of the tensor fascia lata. Tensor fascia lata is nothing but the TFL, and then there is also the piriformis. So there is the TFL, there's piriformis, as well as presence of the sartorius. So all this are part of the abduction. Next, what we have is the adduction. So what is happening in terms of the adduction? So in terms of adduction, so before we move ahead, let's try identifying in the, if it's present in the images we discussed. So we have the, so we saw adduction, right? So in terms of adduction, we have the structures. So there is the adductor brevis, adductor longus, and the adductor magnus. So as the name suggests, it is for the adductor. As well as there is presence of the gracilis. So where do we have gracilis? Gracilis is present here. So gracilis and the adductor muscles, they are involved in terms of the adduction. Now let's move ahead with the medial rotation. So MR stands for the medial rotation. So what is the involved? It is a gluteus medius. So there is presence of the gluteus medius, there is gluteus minimus, as well as there is presence of the tensor fascia lata. Tensor fascia lata we are writing as a TFL. Tensor fascia lata, as well as the presence of the adductor muscles. So let's try finding it out in the images. So we saw the presence of the gluteus medius. So there is the gluteus medius. So there is the gluteus minimus. There is presence of the gluteus medius, as well as there is a tensor fascia lata and also the adductor muscles. Tensor fascia lata, as well as the presence of the adductor muscles. So all this are involved in the medial rotation. Then let's look at the lateral rotation. So the LR, that is a lateral rotation, there is presence of the gluteus maximus. So there is gluteus maximus, there is a obturator internus, then comes the superior as well as the inferior gemelli, then there is a quadratus femoris, the piriformis, and also it's assisted by the obturator externus, and also the sartorius. So let's try finding it in the images. So there is the gluteus maximus, there is obturator internus, the superior inferior gemelli, there is a quadratus femoris. So there is the gluteus maximus, there is a quadratus femoris, as well as the presence of piriformis, and it is assisted by the obturator externus and the sartorius. So obturator externus and the sartorius. So all this, it contributes to the lateral rotation.